Hi, I'm Dr. Johnny. Welcome to Raji's Quickie, and today it's on noses and PDO threads for the nose. Is it a good idea? What kind of thread should we use? What kind of results can I expect? Is it painful? We're going to cover those things today. The PDO nose threads are really common and people seek them out for many reasons, but also because filler can cause a lot of problems in the nose with necrosis, blindness, and other risks. Should you be doing PDO threads in the nose? Let's talk about it. Raji's Quickie. Okay, so the nose. A lot of people, especially in different cultures, 17 or 18 years old, they're getting their nose fixed and redone. It's kind of like the 18th birthday wish, and that's what they get. A lot of times, people are unhappy with the nose, the shape, there's the tip, there might be a bump up top, it might be too big, it might be too wide. For something that's, to many people, seemingly simple, it's very complex. Revisions aren't uncommon, meaning if people have surgical nose jobs or rhinoplasty, a lot of times they want revision. The septum is also in the middle. Sometimes it's deviated. There can be breathing problems. After surgery's been done, it's fraught with problems if you're trying to do non-surgical procedures, especially fillers. So what are the main complications? Why are we talking about threads? And why is it that we're not just talking about fillers? Remember, if you like these videos, if they're helpful, subscribe below, click the like button. It really helps us grow our community and helps me keep these videos coming to you. And Raji's Quickies is something new. Let me know at the end in the comments, do you want the longer ones? Do you like the shorter ones? Now, the PDO threads that are used in the nose are specific. They're shorter, thicker threads. And like I was talking about, why not just fillers? Even if there isn't revision, rhinoplasty, in other words, if they had one surgical procedure done, the anatomy is distorted enough that people certainly don't want to do fillers after that, especially if you don't do them a lot, because necrosis, so death of an area of the nose because of lack of blood supply. And even if there wasn't prior surgery, blindness is another risk. Number one area up in the forehead, mainly seen in Asian countries. Here in the United States, many people won't inject this area. And then number two, high risk, is the nose. And so people are really careful. Even if you aspirate back, there are communicating arteries back to the retinal artery. And if the filler goes through, that could be a problem. Not a good one. So PDO threads, we don't see necrosis. We certainly don't see blindness from it. There haven't been reported cases, at least. Anything's theoretically possible. You never want to say never. But here you can see threads being placed in the nose in succession. These are PCL threads, and I think PCL are a good option for the nose because they last a little bit longer than PDO. PLLA are also possible to be used here. Does it hurt? You can use a bit of anesthetic. I've seen people do lidocaine with epi. Of course, you got to be careful with necrosis, especially if there was surgery prior, but I'm not brave enough to do that, and you can use just regular lidocaine, and then of course you don't feel very much. And of course most of these are now loaded on cannulas, so there's only one sharp opening, and because they're shorter, you can create a 1, 2, or 3 point nose lift with these threads, and you can narrow, you can help with a lump, you can help the tip just in the way you put these threads in there. So I think PDO and PCL are good choices for the nose. You want the thicker thread. PCL is going to last you a little bit longer. Are you using nose threads? Have you thought about getting them done? Have you had fillers? Maybe you don't mind getting fillers in the nose, or you're a practitioner who does them. Nothing wrong with it. It's stratifying the risk for what you want to take on. So that's a Raji's Quickie, PDO nose threads. You can do many things with them. Thanks for joining me. Click like, subscribe. Join me also over on Instagram. Keep your skin and body beautiful, healthy, and vibrant.